Hey everybody, Adam from Jamf. Last week I had the opportunity to do a couple webinars with our healthcare customers, and we dug into different ways that they're using Apple devices at their hospitals. But in each one of these webinars, we came back to the theme of response to COVID-19. And we heard some really interesting stories about how these teams are, adapting and flexing, changing on the fly, taking iPads they might have for some purpose and converting them for telehealth, ensuring that iPhones the care teams have allow them to virtually come into a room rather than actually physically coming into a room. And also how these devices could allow a patient to be at home, monitored, so we actually don't even need them to come into a facility for a test. Or somebody who does come in and present positive, how we can send them home with a way to monitor them. So please check out these next 3 little snippets of the stories. Feel free to share this. And if you have any questions, comments, or ideas about how Jamf and others can help, please let us know.
Touching on why we're doing this webinar, as Adam said at the beginning, we are not at HIMSS. So on the next slide, you can see that is that's an image of the thing that is causing all of the angst at this point in the world with coronavirus. And one of the good side effects that we have found with this program is the increased agility that we have now to flex or deploy something different through the iPads that we have at the bedside, or the mobility options, as the first slide in the deck showed, the 11,000 devices, mobile devices that we have here at Geisinger. We last week were able to put in place very quickly a variety of devices, mainly iPads, that potentially would allow communication either patient to family or patient to provider in an isolation situation. So luckily we do not have any patients at this point that have had to be isolated because of this, but on the off chance that we will, we now have these devices that we can deploy either our clinical applications to allow telemedicine encounters to happen, whether it's because a provider is under the weather and they don't want to come into the hospital, and they can do the encounters from their location into the hospital, or if they're at the hospital and don't want to go into the room, we can provide that kind of connectivity into the room itself. And then the flip side of that, if the family members are in some cases quarantined at home and they can't get into the hospital, these iPads can be used either with FaceTime, with WhatsApp, with Facebook. Any of these audio video connections can be used on these devices to allow that communication to happen, so that the patient doesn't feel as isolated, so that they still have that connection to the outside world. So this agility, I can see, version 4 of what we call the interactive patient system is going to allow us from an IT standpoint to flex with whatever is thrown our way.
Looks like there's another question coming in, just kind of with the relevance of the cancellation of HIMSS, and of course, what's top of mind regarding COVID-19. Any thoughts about how this technology may come into play at your organization for any component of how you're responding?
Well, one of the things, that's a great question. One of the plans we have is, I think like most all hospitals, we're looking at the number of negative pressure rooms we have. Should we get in a situation where we begin to have issues? Like everybody else, we are certainly recommending that folks who are experiencing just normal flu symptoms stay home, quarantine themselves. But when we do see respiratory distress and some of the very things that the CDC guidelines provide, we're going to end up with those folks in our hospital and most likely in our negative air rooms, our isolation rooms. So what we're going to do there is we're going to use a piece of software we have that will allow us to put an iPad in the room with the patient, and then the doctor, the nurse, anybody that needs to, through their iPhone or any other Apple device, or for that matter, even a PC, will be able to communicate with the patient. And so, we think this is going to be pretty important, because one of our goals is certainly to care for the patient, but it's also to minimize the number of folks that are in and out of that room and potentially spreading, the virus. So we're excited about that. We're not excited to have anybody in this situation, but if we do, we're prepared to be able to communicate.
The focus on everyone's mind is how we are tackling this COVID situation, and we are leveraging this solution here at UVA to support patients screened and may require monitoring at home. Just one that happened this week, Adam, I'd like to share. One of the nurse practitioners who will be monitoring this patient and had not used the technology yet said, it's just so great we have this to provide, especially in a situation like this. And so the ability to scale is important to the institution. It's important that clinicians who are boots on the ground know that they're providing something that's meaningful to the patients. And then the patients, once they're home, know they're using something that's dependable and keeps them informed, but also their clinical team. And most of the feedback we get are anecdotes and quotes are consistent with that theme.